Where is your spinal pain coming from? Well, three common culprits are: number one, pinched nerves or sciatica; number two, the small facet joints that are paired on either side of your spine at every level of your spine from your neck down to your tailbone; and number three, the two large sacroiliac or SI joints at the bottom of your spine. Sometimes your pain is coming from just one of these areas, but frequently we find that there's more than one contributor. And figuring out spinal pain is tough because all these areas can refer pain into similar parts of your body. If you're having spine pain or neck or back pain, it's important for you to familiarize yourself with these three culprits, because in doing so, you can become a better participant in your treatment. We often see disc tears on MRIs. What are they? Disc tears are called annular tears or annular fissures. They're simply tears in the outer wall of the disc. They're quite common and are often due to excessive twisting forces on the spine, in many cases while the spine is subject to an increased load. Repetitive twisting or lifting motions, improper lifting, and sudden uncontrolled movement of the spine that can occur with traumatic injuries such as a fall or car accidents are common causes of these tears. Our spines move hundreds of times a day in different directions, bending forwards, backwards, side to side, and twisting. We can't avoid these motions, but we can try to minimize their impact on our discs. For example, look at this image. When we cannot open a jar, we'll often place it on the counter and press down on the lid as we try to twist it off. This creates enough friction to open or tear the lid from the jar. The same thing can happen with your spine if you load it with weight, which could be your body weight or something you're lifting. When your spine is loaded with weight and twists, it can create enough friction to tear the disc. That's one reason why, when you're moving heavy objects, you want to keep your feet pointing in the same direction as your head in order to avoid tearing your discs with twisting. The outer covering of your disc has a lot of pain fibers, so these tears can be very painful. They can heal with scar tissue over time, but it's a slow process because the discs have a poor blood supply. Scar tissue will eventually form, but that area will forever remain prone to future tears and injury because the scar tissue is not the same as the original tissue. Just like when you glue something together, it's always prone to breaking again in the exact same location. The symptoms from these tears can be successfully treated with epidural steroid injections. However, a promising treatment for annular tears is now platelet-rich plasma, or PRP, that is injected directly into the disc tear area, putting your own body's powerful healing cells right where they need to be.